hope you'll excuse me if I read this, and I'll try to talk slowly in case you don't understand it all. But I want to say how very inspiring it is to be in a country which is interested in re-examining drug policies. And it's rather obvious that ones we've had for the last 40 years have failed in all what they've been trying to do. I set up the Beckley Foundation in 1998 in order to produce a rigorous independent review of global drug policy, aiming at reducing the harms associated with both the misuse of drugs and the policies that aim to control them. The Foundation also has a scientific program where we work in collaboration with leading scientists around the world in order to increase our understanding of consciousness and how psychoactive substances affect the human brain, and in what way they might be used beneficially, as well as examining the harms. In 2006, I decided to convene the Global Cannabis Commission report, as I was amazed that although cannabis, or marijuana as you call it here, is by far the most widely used illegal drug, with an estimated 190 million users worldwide, accounting for 80% of all illegal drug use, it was, and indeed is, hardly mentioned in international drug policy debates, as was shown at the meeting in Vienna last March. It wasn't even mentioned except as a tiny little subplot. It is in fact the elephant in the room which maintains the war on drugs. The report has just been published as a book by Oxford University Press entitled Cannabis Policy, Moving Beyond Stalemate. The aim of the Commission was to bring together the latest scientific evidence of all the important issues surrounding cannabis use and the policies that control it, in order to enable policymakers and others to make well-informed decisions on how to better regulate cannabis. 5 of the world's most respected drug policy analysts compiled the report, of whom Peter Reuter and hopefully Robin Room are here today. The report gives an overview of the harms associated with cannabis itself, in particular when compared with other drugs, and the harms inflicted by different policy approaches used around the world. It comes to the conclusion that 50 years of prohibition have not only failed to meet their stated aims, but have inflicted considerable social harms in the process. These harms are particularly severe in producer and transit countries, where the stability of the country itself could be threatened. The report also demonstrates that cannabis policies, whether draconian or liberal, have little or no effect on the prevalence of use, and that which is prohibited cannot easily be regulated. It examines the advantages of different systems, from decriminalization to a regulated legal market, where the large profits are taken from the hands of criminals, and the product can be labeled for strength and content, thereby making it safer, and the sales can be controlled and taxed, thereby providing extra money for education and treatment. The report concludes with a list of recommendations and outlines how a country or a group of countries can set about adopting policies that better suit their individual needs, rather than the current international conventions with their one-size-fits-all approach. The report further describes how a country can renegotiate its conventions on cannabis. I now introduce you to Peter Reuter.
I should apologize for being the only person in the... Can everyone hear me? Oh.
No.
Can you? I apologize obviously the only person in the room wearing a jacket and a tie. And all I can say is that I started this trip in another country in which that was the right way to be dressed, and I had a small suitcase, so here I am. Could I have the slides? So I will summarize here the book and focus on what I think is most relevant to this audience. And you know, the starting point is exactly what Amanda said. Marijuana is the most widely used drug by a long shot throughout the world. There seems to be more of it used now than there was 10 years ago in the world. It varies by country. Everywhere it's prohibited because every country has signed what's called the Single Convention on Narcotic Drugs, and there was a later one that reinforces that. But it's obviously hard to prohibit a plant which grows almost everywhere. And though arrest rates for drug use, for use of cannabis are very high and have been increasing quite dramatically in many countries, nonetheless it is widely used. It gets almost no attention at the international level. There's always much greater focus on drugs that are more harmful, but are used by much smaller populations. It's really re-emerging as an issue. Cannabis policy is re-emerging as an issue internationally because of things that are happening in this part of the world. The Latin American Commission on Drugs and Democracy report has clearly had a real effect. And Argentina, Mexico, and Brazil, and a number of other Latin American countries have made changes with respect particularly to cannabis that have attracted a lot of attention, including very critical attention. This is an excerpt from the report just issued yesterday by the International Narcotics Control Board, which is kind of the international watchguard of the conventions. And what it says, you know, this is written in the typical international bureaucratic language. The board notes with concern is a way of saying we are extremely unhappy about, that's the translation, I think, countries such as Argentina, Brazil, and Colombia, and in countries in North America, such as Mexico and the United States. It's really wonderful that the United States is on the list of disapproved countries, and it's actually somewhat unfair in the sense the federal government is pretty strong on that. There is a growing movement to decriminalize the possession of controlled drugs, in particular cannabis, for personal use. So the INCB sort of represents the old guard, and any changes that are going to be made in Latin America, I think, will need to sort of confront the challenge of the international system. And what we talk about in the book, and I think is one of the real contributions to the book, in particular Robin Room did, is how to deal with that challenge, if one do it. But I will get there, first of all, by talking about cannabis as it's currently used, how harmful is it when uses it, and current policies, then talk about previous reform efforts and the possibility of going beyond just decriminalizing use, and then how to change the conventions if one does want to do more than follow a fairly mild reform. The first thing to start with is, how harmful is cannabis? I use cannabis somehow, that's in the title of the book, and it's sort of used a lot. In more, everywhere except in the Americas, cannabis is the more usual term. On current patterns of use, there's a fair amount of research, and you know, it constitutes a small to moderate public health problem. It's clearly much less a public health problem than alcohol or tobacco, but it's also a much smaller problem than heroin or methamphetamine. Many more people use alcohol and tobacco, and fewer people